Hey, welcome to my live broadcast. The topic is COVID. We got Biden as the president-elect, and he has declared that he is going to address COVID. I guess he's saying in quite a substantial way, so we'll have to wait and see what he's actually going to do. But I wanted also to present an informational link. My brother works in medicine. He sent me an informational link about COVID. And I'll bring that up. I put the link, hopefully the link works. I haven't tested it because I'm still recording this video. I could go back and test it. It's a link for real-time U.S. COVID risk information. So it's quite an interesting link informationally. I can pull that up here. But I'm pulling it up here now on another tab, seeing if it loads. Oh, no, it's having oh, there it goes. Okay. So it's called COVID Act Now. They accept donations. They are a tiny nonprofit working relentlessly since March to bring you trustworthy COVID information. And they're asking for help to make their work sustainable by donating today. I haven't researched them. I don't know their charity rating or anything like that. So it's an America's COVID warning system. They're determining risk levels for 50 states and 3,000 plus counties. So they've got a risk level of red, orange, yellow, and green. The whole USA is all red and orange, the two highest risk levels. I'm in Minnesota. It's got red there for Minnesota. The whole center of the country, the whole Midwest, all the way from Nevada over to the east, towards the, except for the very East Coast, is all red. Texas is red. Looks like the West Coast, from Washington down through California and down, has orange, the second highest. And then basically most of the East Coast is orange from Florida on up. And then Maine and another few states have red. So the whole country, according to this, has work to do. Alaska is red, Hawaii is orange. Looks like they got Puerto Rico on there, it's orange. So the whole country's got work to do. But some of the information they point out is daily new cases per 100,000 people. They've got all the states. North Dakota, one is the worst, 174 daily new cases per 100,000. Then South Dakota, 128. Iowa, Wisconsin, Nebraska, Montana, Illinois. It gives you the infection rate, the positive test rate. Now they've got, here's an interesting one. In the ICU, the intensive care unit, headroom used. South Dakota is in red at 100%. So apparently, South Dakota, and so is Montana, is at 100. For the ICU space they have, they're using it. Apparently, what this would lead me to believe is that they're using it as 100%. They're at 100% utilization of ICUs, I guess, with their, maybe because of the COVID. Then they've got a category called tracers. They've got how many percent tracers they have hired to try to contain it, see who has it, and inform people to help out contain it, I guess. So, yeah, that means there's no more ICU space for new COVID patients. Or what about anyone who needs the intensive care unit? So their medical ability is not keeping up with demand in those states. I guess is what that would lead us to believe. And we saw a lot of this in the news earlier in the COVID scenario. As that played out over time, we saw this in the news in New York and places where their ICUs and everything totally filled up. But apparently that's still happening in some of these other states. But it's not making the major news show news right now. So I've got the news on here. It'd be interesting if they pulled up any information. I wonder when they're going to start doing this. More information about what Biden, president-elect. Of course, they're focusing on the election and the legal. Some of them are focusing on the legal challenge thing. But it'll be interesting to see what Biden will do with this COVID situation.
Indeed, it's an honor and a privilege to make these announcements for CNN. What I don't take lightly, and it's certainly a reminder that even when our he's an expert on the Constitution.
Yeah, they're not the CNN and Fox, for instance. Those two main ones. I switch between two channels quickly on my TVs. They're just not playing a lot of COVID information as far as what Biden's going to do. They are showing information how bad it's gotten. They're saying how bad it's like this COVID map, real-time COVID system is showing, website is showing. They're showing how bad it has gotten. So those are the same. That website and the news are the same. But they're really still focusing on a lot of election stuff.
Where his lead is over 20,000 votes in Arizona right now. In just 73 days, he'll take the oath of office as the 46th president of the United States. His top priority is likely to be stopping the coronavirus pandemic, which so sadly gets worse and worse by the day. On Saturday, there were more than 126.
Here again, they're saying coronavirus is getting worse by the day. Highest day reported COVID since the pandemic began. Here, now they're talking about the new coronavirus task force.
Major actions when it comes to the coronavirus pandemic. We are told that Joe Biden will release the names of his 12-person task force that will work to tackle this pandemic before he even gets into office. Biden, so much during his campaign, talked about how his response would be led by scientists and experts, and that is something that he is making good on tomorrow when he announces his coronavirus team. The coronavirus pandemic shaped so much of Joe Biden's messaging in the closing months.
Okay, so Biden is announcing his coronavirus task force team. They're saying scientists and experts. He's announcing that tomorrow.
Joe Biden spent today here at home in Wilmington, Delaware. He attended mass with some members of his family and also visited the gravesite of his late son, Beau Biden, as the family has really been enjoying these past few days of this moment that they've really worked for together for so many years. And Biden has also been receiving some congratulatory phone calls, including one from former President George W. Bush, that Republican 43rd President of the United States. Speaking with Joe Biden this morning, he released a statement saying, "I extended my warm congratulations and thanked him for the patriotic message he delivered last night. I also called Kamala Harris to congratulate her on her historic election to the vice presidency. Though we have political differences, I know Joe Biden to be a good man who has won his opportunity to lead and unify our country." And then President Bush went on to add, "The American people can have confidence that this election was fundamentally fair. Its integrity will be upheld and its outcome is
Okay,
fair."
so
This is quite the contrast.
tomorrow we'll have to see what we can learn about this new Biden coronavirus task force. They're saying we're at the worst amount of cases since the beginning of coronavirus. So it's kind of out of control. The ICE, I don't know if there are skeptics and unbelievers in it, but they're saying the ICUs are full in some of these states. If someone's healthy, I don't work in an ICU. I don't know what goes on there, but if someone, what level of problematic health do you have to have to be put into a COVID ICU or for COVID or whatever? The ICU is a pretty high level of care, isn't it? The intensive care unit. So you'd have to assume that these guys and gals, whoever they are in there, they must be in pretty rough shape to need ICU care. Again, I have no formal medical training, and I've never worked in an ICU. So.
Right now, he does not intend to do that, because we heard from Chris Ruddy, who is the CEO of Newsmax, a friend of the president who had spoken with him, and earlier today he said that right now the president does not have any intention of conceding the election. Now, of course, it's not required for the president to do so. He will still have to leave the White House when it is time for Joe Biden to be inaugurated, to move into this White House, to have this transition. But it does raise questions about how the next several weeks are going to go, because as Arlette noted, there is still a pandemic going on. There's a task force here that is still working on that pandemic, but they're not meeting nowhere near as regularly as they were in previous months. So the question is something as simple as that, not only transitioning the logistics of government, but also transitioning the handling of this pandemic and how that looks like in a Biden administration, and if the president wants to try to stand in the way of those efforts, or if he wants to help them go more smoothly. Now, so far, the president has continued to push these baseless allegations that the election was stolen from him, that there is widespread voter fraud, even though his campaign has not presented any evidence of that, and we've asked him for it. Well, so that's the question going forward, of how these next few days look. But right now, what we know is the president has not called Joe Biden, the vice president has not called Senator Kamala Harris, and what we do know is the president has spent the last few days at his golf course. He was there yesterday as they called the race. He was back there again today. And now he's at the White House. And we do have a clip, which means, well, right now we are not expecting to see the president today.
All right, Caitlin, thank you very much. Let's go. Let's bring in Bob Woodward right now, his brand new book on the.
I don't know what the YouTube categories really do when you categorize a video. It must affect something. I'm not well educated or versed in what that actually does. This video could be in different education about COVID, news and politics. See, it's Biden and his task force news. Could be you could also call it activism if you think, if you believe people should be activists about COVID and wear their masks, social distance. And with this website I'm presenting, it could be categorized as activism for trying to minimize this ICU result. One idea would be if COVID prevention can help reduce that.
Well, we'll never know, but it's catastrophe what he has done. When I talked to him on February 7th, I thought he was talking about China only in the next month when the pandemic exploded, that I realized what he was saying. And then in May of this year, learned of this